friends. I am Dr. Nirav Mehta, a consultant neurosurgeon, brain and spine specialist at Bombay Hospital, Mumbai. Today I am going to talk to you about brain tumors. Brain tumors is not that scary as it seems, and we need to understand them in more detail. First and foremost, what are the symptoms of brain tumor? How do you know? How do we understand? How do we get an inclination that we may have a brain tumor? So I will just enlist a few common symptoms which a patient would get, for which he should seek advice from the right doctor. So one of the symptoms would be headache. Now don't worry, headache is not very common in patients of brain tumor. It is one of the symptoms which may be seen in less than 10% of the cases. In 90% of the cases, a brain tumor would probably have a very simple cause like migraine or acidity or lack of sleep or a bad schedule. So it's not that all headache patients will have brain tumor, but the atypical headaches, like headaches usually occurring on waking up in the morning, and headaches would be associated with vomiting. Those are the ones which need to be investigated. The other common symptoms would be seizures. Seizures should always and always not be neglected and should be investigated, as many a times there is an underlying tumor which results in seizures. Decreased hearing sounds in the ear, decreased vision in one of the eyes or both the eyes should be investigated. Loss of balance. Many a times patients come with us with a tumor which is involving the cerebellum, and these tumors which come would present with imbalance. There would be a patient while walking would lose its balance to the left or to the right. Now, in case somebody has such symptoms, whom should they see? Well, the ideal person would be either a neurosurgeon or a neurophysician. So you should seek appointment with such doctors rather than going to family physicians, as family physicians are not equipped to deal with such patients. Okay, and what is the investigation of choice? Well, the investigation of choice in such cases is an MRI of the brain, which is done like a plain study, and then they inject a dye and a post contrast film is taken. This is the investigation of choice, which tells us about the location of the tumor, the characteristic of the tumor, so that the doctor can plan what is the appropriate treatment for brain tumor. Now, coming to the last part as to what is the treatment. Okay, see, most of the brain tumors would require some form of surgical intervention, if possible, a complete excision, and sometimes when it's a deep tumor, we end up only taking a biopsy. Okay, so with a lot of new advances in technology, okay, it is not like that the whole skull is open, which is the normal concept of layman, that the whole brain has to be open. No, nowadays we do a very guided surgery where only the part of the skull where the tumor is there, only that much is opened and the tumor is removed. Most of the patients do very well after surgery, so there is no need to, you know, be dismissive about it or feel about it that, oh no, our patient has got a brain tumor and he has no hope. Patients do very well, and depending upon what the tumor is, uh, the future treatment is decided, if whether it's a benign tumor or it's a malignant tumor. Benign tumors usually require only surgery and no additive treatment, while malignant tumors, we have to send the patient for radiation or chemotherapy in some cases. Yeah, so I hope you got some idea about what is to be done in case there are symptoms of brain tumor. Do take care, dear friends. Thank you.